Hi, everybody. Welcome. My name is Hensley Evans. I'm a partner with ZS Associates. I'm based in Zurich, Switzerland, but I lead our patient practice globally. It's nice to see you. I think that folks will probably be joining as we go, but we'll get started on time. Our topic today is talking about why the industry as a whole has struggled to deliver on some of our ambitions around patient centricity, despite kind of widespread agreement that it's critical for all of us. I'm joined by a colleague of mine, Sharon Scotliff. I'll let her introduce herself, and then we'll jump right in.
Great. Hi, everybody. Thanks so much, Hensley, and thanks everybody for joining us today. My name is Sharon. I'm a manager in the New York office of ZS, and I lead our patient centricity work in the US. To kick us off, we wanted to start by sharing with you a story that was passed on to us by a patient, someone going through a journey with their condition. And so we have that recorded. I'll play it now and give you a sense of why this is very important to pharma.
As she sat in her infusion chair, Ro reflected on her treatment and the fact that she now sits in a spa-like environment getting her treatment for Crohn's disease. A TV commercial for a pharma product echoed in the background. Talk to your doctor. And just then, Ro thought, if anyone in the medical profession had asked me what I wanted, I would never have talked about chairs or flat screen TVs. I would have said that at a time when coronavirus is sapping this country's healthcare system, I'm actually really uncomfortable at being allocated this much medical attention and luxury. I would have said that I almost don't care about the setting or even the drug, as long as I can tangibly see that I am improving. I would have said that it makes me sad and sick to see fellow UC sufferers on my Facebook group talk about life with UC without health insurance. I would have said I'd like to talk to someone who can walk me through the different medications and surgical options available and help me anticipate what the next 10, 15, 25 years of this journey will look like. I'd like this to actually feel like a journey, a guided journey, and not a series of random events that I have sometimes exercised agency on, and sometimes not. I have talked to my doctor, and it's brought to a place that I think was designed by people who have never talked to a patient.
Yeah. You know, every time I hear that, I'm struck by that last sentence, that people really do want this to be a guided journey, and that there's a lot of room for improvement. Unfortunately, Ro's experience is not unique. So what is it that's keeping pharma from getting it right? Today, we're going to share with you some data from a few recent ZS studies that help illuminate that picture. What you see here in the top left is our patient centricity industry study. And what we learned there is that while pharma agrees that patient centricity is important, we still don't have the resources in place to make a significant impact. And the meta-analysis of what pharma is measuring when it comes to patient centricity showed us that part of the reason is that when it comes to measurement, we're still focusing on measuring ROI and not what drives it, which is that patient experience. And pharma is just not measuring that. And so we set out to change that. And this year we piloted the patient experience index that you see here on the bottom left. And the idea here is to provide a mechanism where we can get the patient experience from the amounts of patients and caregivers and start to understand that. And so we'll share some high-level findings with you today. And then lastly, to help us understand what great looks like, because we always get that question, we took a look at the practices, behaviors, and organizational models of Best Buy, Amazon, and Disney theme parks and resorts. And we'll share with you some of our key findings there. I'll turn it back over to Hensley now to take us through some of the learnings.
Great. So before we do that, I want to ask you guys to provide some input. By the way, this WebEx that we're hoping will be interactive. We'd love for you to ask questions either through the Q&A or in the chat as we go. So please do feel free to jump in as we go. But I'm going to launch a poll. Would love to hear about within your organizations how much emphasis you are putting on being patient-centric. Is it top priority, part of almost every decision, significant focus, some level of focus, or not relevant? Super glad to see not much showing up in not relevant so far. I guess you all can't see the results yet. I'll give it another 15 seconds for folks to vote if you have a chance, and then I'll share the results. All right. So let's share the results. So it looks like the majority of you are seeing a significant focus at your organization being put on patient centricity, and another significant percentage of you, 28%, are saying it's a top priority, part of almost every discussion. A few of you are saying it's some level of focus, and I guess one person said it's not really relevant. So let me quickly share another poll with you and ask you a different question. Unfortunately, I'm not able to see. There we go. I'm trying to share the next poll. There we go. So quiz question. What percentage of pharma companies would you believe think a focus on patient centricity is critical? Great. Getting lots of responses. All right. I'm going to go ahead and share the results with you guys. It was pretty evenly split between 93 and 78% of you thinking that, or well, pretty evenly split in terms of those of you that think it's 93% and 78%. I'm going to go ahead and show you the results. So those of you that said 93% were correct. So as Sharon mentioned, we conducted a poll at the end of last year among leaders in patient engagement, patient centricity, and patient experience roles across pharma, MPS, and biotech. And 93% of the respondents said that a focus on patient-centric leadership and culture was critical to their organization. But interestingly enough, there was a huge gap between kind of what we want to do or what we think is important and what we feel like we're delivering. So only 16% of the respondents said that they clearly understood their own roles and responsibilities in patient centricity initiatives. And I found this particularly striking because we went out to people that were very specifically in patient engagement roles, patient centricity roles, patient engagement roles, patient-focused roles and responsibilities. Only 14% that said they felt or strongly agreed that they felt empowered to be patient-centric, and only 24% thought that their organization had a culture of collaborating with patients, caregivers, and the community. And so we wanted to understand kind of what was driving this gap. And one of our hypotheses is that a significant driver of this gap is the allocation of resources to sort of make patient centricity a reality, right? So most of the folks that we talked to didn't consider allocation of funds for patient initiatives as critical. So they viewed patient centricity as important, 93%, but only 37% thought that allocation of funding for patient initiatives was critical. And only 6% said their teams were fully funded and resourced for patient centricity activities. So it's not super surprising that we're seeing kind of a gap in delivery of great patient experience if we don't allocate resources appropriately to make some of these initiatives a reality. And then finally, I think that one of the most important activities around building in the patient voice to the organization is the sort of dissemination, the collection and dissemination of patient insights, right? If you don't know what the patient unmet needs are, if you don't have that patient perspective, it's very difficult to make patient-centric decisions and to turn that into a great experience for patients. So only 12% of the folks we talked to thought that patient insights were well disseminated within their organization, that they had some mechanism to distribute and leverage the insights that they were gathering across different teams within their organization. And another great source of patient insights, obviously patient data and the analytics that we can perform on the data that we have about how patients are moving through their journey, how patients are interacting with us. And only 6% said that patient data analytics were performed in a regular way to provide insights to them. So it was kind of clear where the gaps were as we went through the feedback that we received. And we thought, well, why, right? So we all know it's important, but so if we know it's important, why aren't we dedicating the resources that are necessary to make these things happen? Why aren't we disseminating insights? Why aren't we collecting the data or looking at it in a consistent way? And what we found is that there's a really significant measurement problem in terms of understanding the impact that patient centricity can have on the pharma, brand or company's business, but also the impact on the patient, right? So if we think about the way that this should work in theory, right, is that we do some set of activities that are focused on patient needs, patient insights, patient centricity, right? Those activities should ideally change something about the experience that the patient is having with us, right? Like if we're collecting better insights, hopefully that allows us to deliver services and solutions that better meet the patient needs. And hopefully if we're delivering a better experience, that's driving impact in terms of the patient, right? A better outcome, whether that's a clinical outcome or a patient-reported outcome, or better business results for us because we're delivering a better solution, it's more differentiated, and driving better business results. What we found, though, when we looked at how more than 24 pharma companies measure the impact of their patient initiatives, is that there's really like a couple of layers here. So there's the activity measurement, right? So metrics that measure how much organizational effort we're putting into things, right? And then there's also the patient interaction measurement, right? So how many patients are signing up for my patient support program, or how many patients are coming to my website or calling my nurse hotline? How many patients are enrolling in my clinical trials, right? You can measure a lot of different activity-based measurements around patient initiatives. We also looked for evidence of patient experience-based metrics. So metrics that in some way measured the subjective patient perspective of their experiences with the products and the company, right? Overall. And then finally, we looked at impact metrics, which included both business impact and patient impact. So what did we see when we looked to see how organizations were measuring these different things? So interestingly, we saw that the vast majority of organizations had consistent measurement programs in place for activity-based metrics. So they measured their enterprise level and their patient engagement or patient interaction activities, right? So they knew at an activity level what was happening with their patient programs and how much they were investing in what they were doing. Only 18%, less than 1 in 5, were actually able to connect the patient engagement activities that they were doing to business impact, right? So telling what the ROI of making an investment was. And I'm going to stop and launch another poll here. And ask you to all tell me, what percentage of pharma companies do you think measured the effect on and change in patient experience as a result of their initiatives or programs? So 18% measured the business impact. What percent do you think measured the effect on patient experience? Got 35 votes. Maybe we can get a couple more. All right, I'll share the results here. So it looks like 23% was the winner by a nose, with a similar percentage of you thinking that 10% might be the right answer. A couple of you said 54% and 75%. Well, those of you who said 10% were right. So we found that only 10%, 1 in 10, of programs measured the effect on or change in patient experience as a result of their activities. And 0%, none of the programs connected enterprise level activities to either patient experience or the business impact. So really, what we confirmed, I think, with this analysis was that one of the key reasons for that huge gap between our ambitions, right, our sort of statement around, well, patient centricity is really important, and our investments and kind of what we do, is because we don't know what the impact of what we're doing is, right? We are unable to connect the dots between all of these activities that we think we ought to be investing in and the impact that it has on either patient experience, patient clinical or patient reported outcomes, or business impact, right? So if we're unable to connect those dots, it's going to be very, very difficult to make the business case for making these investments. And particularly if we don't understand what our activities are doing to change the experience of the patient, then how are we going to know what's working and what's not working from a patient-centric perspective? So with that, I think I will turn it back over to Sharon.
Thank you. Hensley, there were a couple of questions in the chat.
Oh, great.
One of them, yes, is around the point that, what can we measure? There are a lot of initiatives that you may not be able to assess ROI or impacts. Maybe you can speak a little bit to ways of measurement.
Yeah, so I think that, ROI is certainly not the be all and end all of measuring impact. And in fact, I think that ROI kind of skips over, the most important lever here, which is patient experience. One of those of you that know me on the phone, I've seen a few friends out there, hi, may have heard me tell this story before, but back when I used to travel through airports a lot, you would notice that, like, after you go through the TSA at Newark Airport or London Heathrow, there's the little stand at the opposite side of the security that has 3 colored smiley faces, right? It's got a green, yellow, and red, and it says, "How did we do today?" Right? And so I said, if the TSA is asking for experience feedback from me on how my experience was at Newark Airport, of all the places, then surely at Pharma we can at least do that, right? We can at least gather a little bit of feedback from our patients when they interact with us, and ask how that experience was. So it could be something as simple as a little bit of feedback in the moment when a patient interacts with our call center or nurse hotline or a website or any other solution. It could also really be around the return to patient, right? So how can we measure? I think there have been a few brands that have published data around their patient services programs. For example, AbbVie has published several studies now on their patient support program and the impact that it has, not only on adherence to therapy, which is obviously a benefit to the brand and to the company, but on overall cost of care, which is of benefit to payers and providers. They've also showed that it impacts the clinical benefit to the patient, right? So they're trying to demonstrate impact in a number of different ways without ever kind of calculating in a public way ROI, right? But showing the impact that their activities are having in a number of different ways.
Thank you. Hensley, another question is around the gap. So is the gap in measurement related to the maturity of programs, or is pharma still trying to figure this out?
Yeah, so I mean, I think obviously like activity-based measures are the easiest thing to put in place. And I think that that's where everybody starts. And it's not to say that there's anything wrong with activity-based measures. You do need to know what you're doing and how many patients you're reaching and whether they are or are not interacting with the various programs and tools you're providing. I think that there are definitely some organizations that don't want to measure business impact, right? That have concerns about compliance as a result of measuring business impact. But I think that measuring patient impact or measuring patient experience satisfaction may in fact be partly a result of maturity of the programs, but also just a result of the prioritization, right? Organizations may not be asking the question about how this is impacting patient experience.
Right, and Hensley, just one more question on in this section, which is I think it's around how are activities selected, meaning which activities, how is pharma selecting which activities to prioritize?
Yeah, so I mean, I think the answer is very very different based on which organizations you're talking about. I think typically it's linked to the overall brand and portfolio strategy, where the organization feels there's unmet patient need and the therapeutic categories that they're operating in. When we work with organizations, we often try to look at the patient journey, right? And what they know about patient insights, where the unmet needs are, and understanding not just where the patient needs are, but where pharma could actually add value, right? I think there's lots of opportunities, to make the patient experience better that probably pharma is not the right solution provider, right? So, it may be that partnering with advocacy organizations, or just, assuming that that's not a place that's appropriate for pharma to play. But really identifying like where's the overlap between the patient need and the place where pharma can add value is typically where most organizations start in terms of identifying where they want to focus.
Great, thank you so much. So with that, let's talk a little bit about what patients tell us. And so we spent a large part of this year developing what we call the patient experience index. And the reason why we wanted to do this is exactly to the point that Hensley made, which is around, we see that in general in pharma, we use different analogies or different other mechanisms to give us a hint about the patient experience. Sometimes we'll look at adherence, or sometimes we'll look at engagement with different channels or materials. But rarely do we see pharma really asking patients and caregivers. So we set out to create something that provides pharma with a good way to get an understanding of what the current experiences with branded products in a specific condition, what impacts and drives those experiences, and then provide some benchmarks that organizations can use to understand how your brands might stack up against other branded medications for a specific condition. And I will say that one of the things that was really important to us as we developed this index is that we work with our ZS subject matter experts, we work with our clients, and we made sure that we worked with patients and caregivers so that we're not designing this in isolation and we're capturing what truly matters. And so for this initial study, we selected 16 brands across 4 conditions. So you see those here on the slide: type 2 diabetes, rheumatoid arthritis, moderate to severe persistent asthma, and Crohn's and UC. And the reasons why we selected these specific conditions is that we wanted to look at conditions that are chronic, that have an impact on someone's daily life that's truly felt. We looked for different conditions that had diverse patient populations in terms of age, sex, race, and other characteristics. And we looked for conditions where there's a diverse set of manufacturers with branded products. So before we go on, I'm going to launch a quick poll here. I've lost my poll. There we go. Okay. And, all right, hopefully everybody can see that. So let me ask all of you, what percentage of patients and caregivers told us that they're satisfied or very satisfied with their experience with a branded medication? So I see a whole people are voting. I'll give this another couple of seconds. All right, so I'm going to go ahead and end the poll and share it with you. So very interesting. Close to half of you believe that patients told us that they're satisfied or very satisfied with their experience. About 20% of you believe that, a quarter of patients are satisfied. We've got one person who's very optimistic, believes that most are very satisfied. And we have about 10 folks who believe that about 3/4 are satisfied. So let me show you what we learned. So this was very interesting. So what we saw is that based on the feedback from over 1,500 patients and over 200 caregivers, folks are pretty satisfied. So that one person got it accurate. In fact, 75% of the people who in our study are satisfied or very satisfied. Now, again, as we reflected on this, we thought, well, maybe that's because those who participated in the study have been on the product for at least 3 weeks. And when we looked at the sample, many of them have been on the product for several years, right? But we wanted to dig deeper, right? To understand, okay, great, you're satisfied, but why are you satisfied? What's driving that for you? And as you can imagine, what we learned is that the thing that people care about most is that it works, right? That if a product doesn't work to address someone's symptoms or side effects, it doesn't matter. Above all else, people care about the effectiveness of the medication, right? And when you think about the conditions that were selected for this study, it makes sense, right? These are chronic conditions, they're not degenerative, and they're not conditions that are generally terminal. And I suspect that if we looked at conditions like MS or Parkinson's or certain cancers, that we might see a bit of a different picture. So if we take effectiveness as a given, right, we take that out of the equation, what we start to see is that the idea of expression, which we define as someone's ability to relate to the brand and believe that they're being supported by the brand, becomes really important. And then just as important is this experience around effort, which is really around ease, and that's closely linked to someone's experience. So let's talk a little bit more about effort. We can think about improving an experience in two ways, right? It could be reductive or additive. So I live in New York, East Coast, and I don't know if any of you remember or are on the East Coast, remember what it was like to try and get yourself over the George Washington Bridge a couple of years ago. You waited in line for probably an hour to 2 hours, and then you had to stop, make sure you had cash and like the exact change so that you didn't have to wait too long, right? It was a pretty excruciating process. So you think about that experience, and there are many ways to make it better. And to make it better, the MTA didn't provide things like complimentary window washing or come to my window with a sandwich. Instead, they removed the friction. They removed what made that experience painful for me, right? So today you go over the GWB, you rarely have to wait. And in fact, in many places in the US and in Europe, you don't even stop to pay a toll, right? You just drive right through. So we can think about it in the same way when it comes to someone's experience with a branded medication. What we saw, and you see that in the quotes here, is that delivering a positive experience is around removing the friction, removing the negatives, making it easier to get the medication, to take it, and to afford it over time. So then we started to look at what mattered to people who are not satisfied with the experience, but they're still in the product. And what we see here is, of course, its effectiveness and effort. That's what matters most. But the really interesting thing that we started to see here, and you see it as the second item on the list on the right, is the emotional impact. And when we ask people to tell us a little bit more about that, it's about being able to connect and relate. So someone with RA said, I feel that the commercials make people without RA think that we have a completely normal life when we take these conditions. Or another person on the left told us, I feel trapped. I want to take this medication, but I'm scared about the impact to being immunosuppressed. And so there's a lot that we can do here in terms of trying to influence and affect this emotional experience. Now, these are just early results. We're still digging into the data, and we'll be happy to share the full results with you all in a couple of weeks. So let me pause here and see if there's any questions before we go on.
There's one question about patient data privacy policies. There's some kind of regulatory hurdles that you don't see in other consumer-oriented industries. A lot of cost associated with accessing patient data, not getting complete data, makes it hard to sort of get insight out of some of our patient-centric initiatives. Any thoughts on overcoming those kinds of challenges?
Yes, definitely. Great question. So there's a couple of different things. What we've seen is that companies will invest over time. So it starts with deciding that having patient data and understanding patient experience is important, and building out a roadmap that says, what are some of the first things that we want to collect? What are the types of databases that we might want to put in place, and get permission from patients to collect that data? The second is, I think, around getting some, investing in real world data. And you're absolutely right, there's an expense that's involved in that. And what we see is that from our clients who have invested in that, they're getting a better sense and better understanding of what might be helping to contribute to an experience one way or the other. And I think a great example is trying to put in some closed loop measurement. So I'll give you an example from DTC. One of the things that can be done is that you can measure whether or not, using a closed loop, and looking at, we often look at how many people did we reach and how many people are engaging. And you can take that one step further and then connect it to, well, then what's happening in the real world? Did the person who see that commercial actually decide to talk to their doctor about their condition? Or are we even reaching the right people with this condition, and what's helping to drive action?
There's one other question that I might jump in and answer, Sharon, about whether this research was done in the US only or across multiple countries. This patient experience index research was done in the US only. Our intention was to really look at establishing a baseline in the US and then expand to other countries. We did do some interesting research last year in the US, Canada, and 3 European markets, in Italy, Germany, and the UK, looking at the difference between patient HCP interactions, and did see some really remarkable similarities in terms of the patient engagement in their care and the degree to which patients agreed that they wanted to have a role in their treatment decisions. But we also saw some big differences in the attitudes about how patients, how and when patients deferred to their physicians in terms of decision making, and how they went about preparing for those discussions. So my expectation is we would see some interesting differences, or we will see some interesting differences when we do this research in countries outside the US, but this right now is US only.
Great, thank you. All right, so then great questions. And with that, why don't we go into kind of the last bit of data that we'd like to share with you today, and certainly we have plenty of time for discussion and comments. So one of the things that we wanted to think about, because the question we always get from when we talk to clients and folks in pharma is, well, then, who's doing a great job? What can I learn? How do the pros do it? And so we decided to take a look at some leaders in customer experience. So Amazon, Best Buy, and Disney theme parks and resorts. And what we looked at are what are the practices, structures, and behaviors that we might be able to learn from. Now, I do want to point out, there's a very different expectation when you are going to engage with Amazon or Disney than when you are going to take a pharmaceutical product, right? You're taking a medication often out of necessity, whereas it's really a choice to engage with someone like Amazon, Best Buy, or Disney. And this is a fact, and this is true. Yet I think the most interesting thing that we start to see are the commonalities between how these organizations behave and some best practices in terms of how they orient around their customers. So what we learned is that with all three companies, they let that kind of desired end customer experience guide their decision-making, and not only think about what they, the company, Amazon, Best Buy, or Disney could impact, but how the company might work with others in the ecosystem to delight customers and to continue to engender loyalty. So I'll give you an example here. One of the earliest acquisitions for Amazon was IMDb, the Internet Movie Database. And for those of you who are familiar with it, you might know that it's a website that gets millions of visitors. Typically, it's movie buffs who want to know, well, who directed this film? What else were they in? What's the story, et cetera. And the reason why Amazon acquired this is because they wanted to understand, they were starting to think about content, and they wanted to understand what are the potential relationships between the types of content that certain people gravitate to. And having that data help them to anticipate that and learn from it, and so help them continue to do a really great job of what you might want to binge watch next. Now, you might think about what then their later acquisitions became, right? So things like Audible, Zappos, and most recently Whole Foods and PillPack. And so Amazon's really been following the same strategy of thinking about what downstream experience might I be able to impact and continue to gain love for Amazon. One of the key findings here is that there's a very deliberate strategy around customer experience, and it starts with a very vocal commitment from leadership, right? For example, Amazon does this very vocally. I think many of you might be familiar with Amazon's 14 key principles, one of which is customer obsession, and that's a key tenet for them from which they start and end every initiative. The idea of customer focus is then embedded and continually reinforced through a very persistent and designed cultural experience. So when we spoke to folks who had worked at Disney, one of the things that they often talk about was the fact that a big part of creating that Disney experience was learning how to become the Disney experience. And what are those characters? How might I see myself in Cinderella or Snow White or Mickey? And that training continues. It's ongoing. It doesn't just have to start at the, just when you onboard, but it happens at multiple periods of time while someone is with the company. And one of the things that's true across all three of these companies is that Disney, Amazon, and Best Buy all rely very heavily on customer insights and data to help them understand what matters most, how that changes, and then be able to anticipate customer needs. So I'm going to launch another poll here right now. All right, so which of these companies do you think does the best job on delivering customer experience? Is it Amazon? Is it Best Buy? Or is it Disney Resorts and Theme Parks? I'll give this another couple of seconds. Seems like we have a lot of you are gravitating towards Amazon, some towards Disney. All right, I'm gonna go ahead and share the poll. All right, so about half of you guys think it's Amazon, 44% see Disney theme parks and resorts, and one person really likes Best Buy. Well, actually, this is a trick question. So they all do a great job. So they all do a great job and in different ways. And I know at some points it's a little bit hard to think about those in-person experiences when you think about Disney and Best Buy. But it is, I think it was useful to point out what is it that they do. So I'm going to start and tell you a little bit about the journey that each one of these companies took to become more customer focused. At Disney, their transformation began in the early 2000s. So Disney theme parks and resorts, their revenues were plummeting. Visitors were not flocking to the parks, and they weren't returning in the ways they once did. And so in early 2010s, what Disney did is they made this very deliberate commitment to customer experience and then began investing in a suite of digital technologies that could help them track someone's experience as they're going through the parks or the resorts and help understand what's going on. Where are their long lines? Can I send someone who really likes this ride to another one because I know that they might like it based on previous experiences, but there isn't a line there. And so putting some of those things in place really helped Disney turn that ship around. For Amazon, it was a slightly different approach, still very much rooted in collecting customer data. But what they started to do in the early 2000s was bring in top-down talent from a diverse set of industries. So fashion, banking, healthcare, film. And the reason why they brought these folks in is to start to think about what else can I do with this data? What other kinds of data about the interactions folks have with Amazon do I need to capture? And how might I be able to use that to help me anticipate what they might want or need next? And then the last one is Best Buy. In the early 2010s, the company was really close to bankruptcy. They were really in financial ruin. And so what they decided to do, they took a very different approach. They decided to focus on what they call, quote unquote, the frontline workers, the folks who are on the floor selling and talking to customers every day. And what they did is they trained those folks, and also they started to get regular feedback from them. Really started to make sure that they're hearing what it is that customers need and want, and gave those folks on the floor the opportunity and the authority to go beyond what's typically offered in the store. And one of the most, I think, famous innovations that came out of this strategy is the Geek Squad. And so this was a really important way for Best Buy to turn things around and really saved it from ruin by the early 2010s. So the common theme that I'd like to point to in all of these three transformations and focusing on customer focus is that, one, it's a journey, right? It doesn't happen overnight. It'll take us several years. The second is that it's about data and a very deliberate investment in getting that data and those insights, doing that over and over again, and thinking about how you could connect different sorts of data. And the third is thinking beyond what you, the company, can provide and connecting to others in the ecosystem. So let me pause here again to see if there's any additional questions that we might be able to cover before we.
So Sharon, there was one in the chat which was related back to the patient experience, and it was asking about whether the hospital consumer assessment of healthcare providers and systems makes it easier to understand patient experience in the U.S. Than in other markets.
I think that's a very good question. So when we developed our patient experience index, actually one of the things we looked at was what components of HCAHPS might be useful for us to think about. I think to that extent, that really focuses on someone's experience within a particular hospital system and focuses a lot on communication and interaction. So I think that's very useful. I do still believe that there's a lot of room to learn more about what happens beyond just your experience in the doctor's office, because our experience with medications, much of it takes place at home, right? Especially if you're in a chronic condition where you're taking a daily pill or a self-injection.
Great. So let me just kind of wrap it up. So we've shared some data from a number of different studies that we've done over the past year or so. And I think the kind of key takeaways for us are that, pharma broadly agrees that patient centricity is very important, but we don't always have the resources in place to make the progress that we'd like to be making. One of the reasons for that, we believe, is that it's difficult now to measure the impact that our investments in patient centricity initiatives have on our business. And focusing on the patient experience, which is sort of like the middle step in turning that initiative into a better outcome for the patient, and hopefully a differentiated value proposition for our brands, may help us to kind of unlock a better understanding of what's working well to improve the patient experience and what's not. What we learned with our patient experience index research with patients is that kind of no-brainer, right? Effectiveness is critical, but beyond that, effort plays a critical role, and removing barriers from that experience may be one of the places where pharma can be most effective in improving the overall patient experience. And we shouldn't forget the kind of emotional connection, and that is often something that can go wrong with an experience, even for patients who are having good symptom relief with a medication. And then finally, while we acknowledge that everybody loves going to Disney World, and not very many people love going to their doctor, although there are definitely exceptions, we can really learn from folks like Disney, Amazon, and Best Buy to see how they've used patient or consumer insights and data to make core decisions about their business and help drive business success, and in several of the cases that Sharon talked about, actually turn their businesses around. So we love looking at those out of category benchmarks, because they give us sort of something aspirational to look forward to. So 3 things that we thought we'd leave you with, sort of things that pharma can do. So 1, talk to patients early and often, and it doesn't have to be complicated to be effective, right? Place a simple feedback mechanism, to give your patients an opportunity to tell you how things are going and provide feedback about their experience. Insist on patient data to inform decision-making, recognizing that patient data is incomplete. We all have a lot more data than we regularly use to make decisions. So think about how you can adopt more data-driven approaches to optimize the experience that you're delivering to patients. And then, I love the Best Buy example, because it really talks about creating accountability down throughout their organization, right? So giving employees simple tools so that they can believe in and sort of understand the impact that their day-to-day jobs have on patients, and create some accountability so that everybody feels like making the patient experience better is part of their job. So with that, we've had a couple questions about sharing the slide deck. We'll be happy to share the deck. If there are other questions that you have, Sharon and I will stick around for a few extra minutes, but do feel free to reach out. So a couple questions coming up. So one is, what are the best channels, best practices to economically collect patient experience data at scale? With the, it's kind of a nod to Disney, Amazon, and Best Buy. I don't know, Sharon, if you want to talk about kind of the massive data set that those guys have probably isn't replicable on the pharma side.
Yeah, no, I think that's very true. I think some of the best ways to get a better understanding of patient experience economically is to start looking at your own assets. It's really interesting. One of the things that we find is that pharma companies actually are sitting on some of the best data, and they may not actually know it. So you may already be collecting some information about your patients from their experiences, interactions with your marketing channels, as they opt into your marketing communications, and from the call center. We find sometimes that just listening to some of those calls is really, really insightful. And beyond that, again, an investment in real world data, we do believe goes a long way. And that's another thing that we often find with organizations, is that there may be one part of your organization that's already acquired that data set. And sometimes there isn't that knowledge. So we're often surprised by how many resources our clients actually already have in-house. I don't know if you want to add to that, Hensley.
No, I think you did a great job there. I did want to address a separate question. So yeah, we will send out the the PowerPoint presentation. So the folks that have asked for that will definitely do that. So Jay actually asked about, I think it's a fascinating question, right? So it says, if I'm already measuring the emotional impact of the experience I'm offering patients, how do I know if my investment is right-sized? And that was one of the key reasons we wanted to do that sort of patient experience index and really understand quantitatively the degree to which each of these dimensions actually impact the overall satisfaction that patients have with a brand experience. What we noted in adherence data, so we looked at like Optum data across brands that were very similar in terms of mechanism of action in the same therapeutic category, and saw fairly different adherence curves for those brands. And so we hypothesized that maybe there was something different about that experience that was driving that difference in adherence. Now, adherence isn't the only measure, as you point out, right? So I think like understanding the degree of importance that the emotional impact has on a patient's overall experience, and how that differs by therapeutic category. I mean, Sharon talked through kind of the high level results, but we do notice some very interesting differences between different therapeutic categories. So the value that patients with RA place on effort is different than the value patients with severe asthma, for example, place on effort, right? So I think understanding some of those dynamics, I believe, will help us make smarter choices about where we specifically invest and like where the emotional connection is more important versus where, you know, efficacy and effort are the most important, for example. Just looking at the chat, where do patients want their experience to start along the journey? Symptoms, diagnosis, treatment choices, persistence on therapy, etc. Well, I'll take a cut at this, and then Sharon, you can jump in here. I mean, I think that the patient experience starts, you know, with hopefully wellness and preventative care, and you know, they aren't patients, right? They're just people. Where they wanted to start with pharma, what we have found is that patients do welcome education and information about their treatment choices, and they're getting more and more involved in those treatment choices all the time. When it comes to support programs, what we hear from patients is that they're really interested in pharma providing things that are sort of around the pill, right? Like, how do I start taking, or around the therapy, right? As a turn of a phrase, right? So how do I get access to my medication? How do I get started taking my medication? What are the things I need to know to help support me in staying on my medication? And they're less interested in pharma providing things that are kind of way beyond that, right? Lifestyle advice, nutrition tips, et cetera. I think we've all probably participated in, you know, recipe apps or the equivalent, right? And I think patients basically say, like, that's something I don't need the manufacturer of my medication to provide to me. So I think, you know, while their experience is kind of all along the way, what they want from pharma is fairly specific at different points in the journey. All right. So we will be sharing the deck. I think we've addressed most of the questions. You have our contact info here. If you have other questions or interested in getting more details around any of these studies, we have some white papers that we've published on some of these. So do reach out and let us know if you'd like more information. We'd be happy to send it your way. So with that, I guess we'll wish everybody a great day, or a great day or a great afternoon, depending on where you are. Thanks so much.